So the corneo-scleral profilometry will give you a lot of information, not only numbers, but understanding how these numbers are distributed on the cornea. So we will see step by step how to understand, first of all, the elevation map, because with corneo-scleral profilometry, we are not referring to the tangential map or axial map with which we are used with corneal topographers. Scleral topographers refer to the elevation map, and the colors also are different. So in the elevation map, we have the purple, blue-purple are the steepest meridian, and the red wine are the flattest meridian. And we know that with the rule to RCT, the steepest meridian in the vertical one, and the flattest meridian the horizontal. So in this case, we have with the rule toric sclera. If you don't remember the colors, you may remember the signs. Where you have minus is because the less elevated, which is the steepest meridian. Plus will tell you that this one is the higher in elevation, which is the flattest meridian. So where this plus and minus are coming from, and why they are considered less elevated and higher, more elevated, higher in elevation. We compare them to a best fit sphere. So everything is above this best fit sphere is higher in elevation. This is the meridian with which is the more elevated. Everything is lower than this best fit sphere is the less elevated. So the first one is, the red one is the flat meridian, and the blue one is the steepest meridian. I like to compare them also to a plane, because every practitioner can do it any time and remember it. This is the steepest meridian, and compared to the plane, you see how the steep meridian is less elevated. The edges of this steep meridian are less elevated from the plane, where a flat meridian, you see how the edges are getting further from this plane, so is a more elevated. So this is something that every clinician can do and remember, which is the flat and more elevated, steep, less elevated. So you can see it here from the graphs, but you can still use your hands. The steepest meridian have the higher sagittal height, the flattest meridian have lower sagittal height. This slide will summarize what we discussed so far. So the flattest meridian is a more elevated, however, the lower sagittal height. The steepest meridian is a less elevated, but has the higher sagittal height. Okay, and this is important because in the pentacam, it will give you both sagittal height in the flattest meridian and the steepest meridian. And here you can see how the flattest meridian has the lowest sagittal height, and the steepest meridian has a higher sagittal height. And now you understand why. So if you are designing lenses and you are designing them toric or quadrant specific, you can see here how the sagittal height are different based on the quadrants. In this case, we have different sagittal height in between the two opposite quadrants of the horizontal meridian, and we know that the nasal part of the eye is the flattest one, and if you see the sagittal height is lower compared to the temporal one that is steepest, so the sagittal height is higher. Again, flattest quadrant is more elevated. The steepest one is less elevated. Elevation is different than the sagittal height. This picture will give you an immediate understanding of elevation. So here it's a mountain, which is asymmetric. You have different elevation on the same meridian. Let's say like this is the ocular surface. On one side, it's more elevated, and the other side is less elevated. This is similar to ocular surface who have significant asymmetry on the same meridian. And we will see this in keratoconic patients, like in this one, you have a keratoconic patient. Again, you see between the temporal and the nasal, temporal quadrant is the steepest meridian, and you see how the sagittal height is higher compared to the nasal one, which is the flattest quadrant. So here you can see why the sagittal height is different between both of them, while the nasal area is higher in elevation, and you can see it because it's similar to our mountain. But if you measure the sagittal height of that quadrant, you see how this area has a lower sagittal height compared to the one in the temporal quadrant, which is less elevated, but it will give you higher sagittal height. So this case illustrates everything we are talking about, the difference between elevation and ocular sagittal height or scleral sagittal height, and the difference between them. Now, when you are applying scleral lenses on such asymmetry, how the lens will behave? The lens will be touching the quadrant or meridian that is highest in elevation and will be lifting off on the quadrant that is less elevated. Now you may have compression on the higher in elevation, and in the opposite quadrant, the less elevated, you will have accumulation of fluorescein behind the lens. Edge lifting, accumulation of fluorescein behind the lens.